Well, we're a new leading healthcare organization for Qatar. Because the Emir in Qatar is developing the private sector, we're here to establish hospitals and systems both in Qatar and outside. And we're very lucky because we've established the first leading hotel hospital concept called the View Hospital, and it's been a fantastic success, only opened 2 years ago. So what that's done to bring into Qatar is a lot of international allegiances, providers and collaborative organizations. So we have Cedars-Sinai from America, we have some organizations from Europe, and we have from Korea, as I mentioned, 4 different partners as well. Now, to establish that in Qatar, being the leading private provider, we've now taken that out internationally. So we're now building a hospital with the government of Algeria. We're building a hospital in Iraq. We're operating 2 public-private partnerships, 600-bed hospitals in Iraq. And we've just opened up our first cardiovascular hospital in Libya. There are so many more projects on the go, but building with Estithmar being our holding company on the Qatar Stock Exchange, we're really establishing a leading private healthcare group in Qatar, but taking that out wider. So it's really about the relationships with governments. Everything becomes relationships and collaborations between the public sector and the private sector and how we can help. Now, the challenge within the GCC community, everyone gets a little bit individualized. Now, when we can group the best partners from around the world, bring them into the region, and then help solidify and standardize the protocols and processes, that creates a lot of trust from both the patients, the funders, and also the governments as well. Now, those relationships are all at the top level. They're between the governments, and they are supporting us delivering the right quality of healthcare to the region. At the moment, we have a group of very good suppliers that support us, and we have a fantastic support from workforce through France as well. What we're looking for is how do we develop technology, how do we look at smart builds, so we do design, build and operate models, but we also operate existing hospitals. So we're looking for that technology support, we're looking for more partners, and we hope with meetings like this that we're going to develop those relationships between France and the GCC, and we're going to help to build stronger relationships all together. We're lucky that we're part of a wider holding group that has lots of other partnerships between France and the GCC going on. So we want to leverage that to really support us in making a way forward and strengthen this each time. For the AI side is that it obviously affects everybody in every area, and healthcare is like no other, like every other organization. It has lots of administrative roles, lots of finance, lots of HR, lots of areas where AI has been a fantastic support, both in the AI assistance model as well as the generative AI model. But when it comes down to specific of healthcare, people talk about supply chain, clinical evidence, processes, protocols. Those things are coming in further and further. That healthcare tends to pretend to be at the forefront, but actually is a little bit more, takes slow steps. And especially in the GCC, we want to make sure it's proven, it's trusted, and it's delivering right quality. As we know, there's a lot of these, are they unproven processes? Are they creating sort of things which aren't quite correct? But there's a lot of good stuff coming in. So the ambient listening, when people are, the doctors can actually talk to you as a patient now, and it's automatically filling in their data. Those sort of elements, fantastic. Giving prompts to doctors to make sure that they aren't forgetting something. Not telling them, just prompting. Looking after certain things like ICUs, helping with the algorithms with when you've got remote ICUs. We're looking after ICUs, intensive care units in Iraq, in Libya, in Qatar. All together, it's lovely that we can have something where there's a whole sort of a good mother figure looking over, just making sure that it's supporting all the mechanisms go out. So there's lots of different steps as we go, lots of improvements happening, and we're really quite excited by how this is being taken out through the area. We are trying and testing as the models as our hub in Qatar, and then making sure we take it out to the regions and it's tried and tested, and people grow our confidence with us.